Hi, my name's Chris, and I'm with the BC Lung Association, and I have the pleasure of sitting here with Dr. Frank Kelly, who is the Professor of Environmental Health at King's College London. Welcome to Vancouver.
Thank you very much. Glad to be here.
Great. Let's get right into it. So here at the Air Quality and Health Workshop, we're talking about things London and air quality. So what are the London Congestion Charging Scheme and Low Emission Zones?
So these are two policies which were introduced in 2003 for the Congestion Charging Scheme and 2008 for the London Low Emission Zone. So the background to these is that it was recognised around 2000 that most of London's air quality problems were coming from surface transport, so from vehicles on the road. And a decision was made by the then Mayor, Ken Livingstone, to introduce these two policies to try and address this problem. The first policy, the Congestion Charging Scheme, was introduced to try and reduce the number of vehicles which were coming into central London every day. So this was operational Monday to Friday, 6 in the morning to 7 at night. And if you wanted to bring your car into London, you had to pay a charge. Initially it was £5 a day. Then in 2005 it was increased to £8 a day. And then 2 years later it went up to £10 a day. So quite an additional charge on top of maybe a parking charge and the fuel charges. Mm-hmm. Now this scheme was successful in respect of reducing the number of vehicles coming into London. Overnight about 60,000 fewer vehicle trips were made. Wow. But of course those people still had to get into the city, so some of them got on motorbikes, some of them got on cycles, bicycles, but the vast majority of them started to take public transport. So we had to increase the capacity in the trains, the undergrounds, and our buses, our famous red buses in London.
That would be big. So you sort of touched on it, but what really was the impetus for these policies, and what organizations were involved in making that all happen?
So the Congestion Charging Scheme, as I say, was to reduce the number of vehicles on the road, to try and decrease congestion. The second scheme, which was also introduced by what we call the Greater London Authority, which is the organisation which rules Greater London, was the London Low Emission Zone. And this was brought in specifically to try and improve air quality.
Good.
It was targeted at the more polluting vehicles, so these are the heavy-duty trucks, and the vans and the delivery vehicles. And this was operational 365 days a year, 24 hours a day. And there was a certain emission quality that the vehicle had to have if it was going to come into Greater London. And that's everything inside what we call our ring road, the M25. So a huge area. And you had to have one of the more modern vehicles to operate within that zone. Okay. If you didn't, you then had to pay a large fine, and I'm talking about a very large fine. For the very big lorries, that would be up to £1,000 a day.
Wow.
Which would be reduced to half that if the charge was paid promptly. So it really led to a change in the fleet, the quicker turnover of these vehicles. And as a result of this, we did see small improvements in air quality in the Greater London area.
So let's talk about that specifically then. How did you evaluate some of the results and the impact of the program on pollution, for example, around that ring road?
So we're lucky in London in that we have got a very, very good ability to be able to assess the emissions of these various pollutants from the vehicles. The Greater London is covered by a network of automatic number plate recognition cameras. So we're able to track every vehicle on the road. That then allows us to query the National Vehicle Database, so we know the emissions of that particular vehicle. We know the speed of the vehicle, and from that we can calculate very accurately the emissions from all the surface transport. We add into that the train movements, the airplane movements, energy utilization by both private and industrial and commercial office blocks. So each year we produce a surface map of all the pollutants. And what we were able to do was we were able to look at the changes which the London Low Emission Zone brought about in respect to vehicle fleets, and we were able to then predict what the change, the decrease in emissions would be from that. That was the first way we went about things. The other reason we did that was we wanted to see where, on which part of the road networks we would see the most benefit.
Oh, okay.
And then once we had that prediction, we were able to look to see where we already had air quality monitoring stations in London. And again, we're very fortunate in London. We've got a very good network. The London Air Quality Network has got over 120 monitoring stations. But even so, we found that there was some key link roads and motorways in London where we didn't have monitoring, where we thought we would see marked benefits from the introduction of this scheme. So we were able then to introduce and place new monitoring in those locations.
Wow. I mean, what a great use of technology, really. I mean, it seems to me that here in Europe, you guys have a great system for the low emission zones, definitely much better than we have here in North America. Do you think that's something that North American cities should implement and should look towards implementing here?
There are many advantages of taking these approaches for regulating vehicle flows in cities. I think it works better in some locations than others. If you already have got an established network of monitoring and a very good understanding of your vehicle fleets and flows on the roads, then it's feasible to step it up to this next level. If you're starting from a much lower level of monitoring and assessment, then you would have to spend a lot of money bringing that city up to spec if you were able to then introduce a scheme like this. So it swings and roundabouts, really.
Right. So let me ask you this then. If the health benefits of such an intervention can't be demonstrated, does that mean that the intervention wasn't worth implementing?
Not all the time. Because one of the problems we had, certainly in Europe, is that our cities are very, very densely populated with vehicles. They're congested, they're not pleasant places to be in. So simply schemes which reduce the number of vehicles on the road, make it a more pleasant city to live in. It allows you to have more walking and cycling, allows you to green up your cities. So from that reason alone, even if you can't quantify the health benefit of that, I think there is societal benefit. Ultimately, if we get our low emission zones correct and we get the right controls in place, then we can remove the most polluting vehicles from our cities, and all the evidence that we have suggests that that must have a health benefit, even if it's a marginal one.
Absolutely. So that's the time that we have right now, and I want to thank Dr. Frank Kelly for joining us all the way from London.
Thank you very much.